All right, good afternoon. First and foremost, welcome to this press conference. With me, I'm Dr. Noor Hisham, Director General of Health of Malaysia. Next to me is the Director of Hospital Kuala Lumpur, and Dr. Masha, the Director of the National Institute of Forensic Medicine, Hospital Kuala Lumpur. Okay. The National Institute of Forensic Medicine, Kuala Lumpur, received a dead body of a North Korean national from the investigating police officer for post-mortem examination on the 15th of February 2017 at 10 o'clock in the morning. The post-mortem examination was carried out at 12:45 afternoon on the 15th of February 2017 and completed at 6:45 p.m. on the same day in accordance with the section 331 of Malaysia's Criminal Procedure Code. The investigating police officer was present throughout the post-mortem examination. The team involved in the post-mortem examination of the deceased person comprised of qualified and experienced consultant forensic pathologists, radiologists, and forensic odontologists. The body underwent a full post-mortem computed tomography, that's a virtual autopsy, external and internal post-mortem examination, and forensic dental examination, of which were conducted professionally in the same place and with compliance to the international standard. The management of the body was done in a respectful way, and medical legal specimens taken were handled accordingly to the provisions of the law to maintain the chain of custody. The medical legal specimens were handed over to the investigating police officer immediately after the post-mortem examination to be sent to the accredited laboratories for analysis. These analyses are meant to confirm the identity of the deceased person and also the cause of death, both which are still pending at the moment. There has been no second autopsy performed on the deceased person to date. So thank you very much. That's the press conference that we have made. And at the moment, we do have the specimen been sent to the lab for analysis. We do have the DNA specimen. We do have the fingerprint, and as well as the dental identification. We need to match accordingly before we can identify the person. So we are still waiting for confirmation with regards to the next of kin, as well as the medical records and dental records from the respective embassy. So this is all impending, and the analysis is not ready yet at the moment.
Sir?
Yes?
Will you confirm who is the next of kin who provided the DNA sample and when was that collected?
At the moment, we do not have anyone claims to be the next of kin, and we are still waiting for them.
But you say that you have a sample that you're going to have analyzed for DNA to confirm
from the deceased person, not from the next of kin yet.
Do you anticipate problems? What if the next of kin doesn't come forward? What is the next step identification?
Dental records. So if you have the dental records, we can match them. We have medical records, and also the external examination in terms of if there's a previous operation, scars, mole, etc.
Has the MC been cooperative in providing?
We are still waiting for the results from them. Yeah?
So any preliminary analysis of the results?
Yes, we are sent to the lab, so we are waiting for the results as well. The lab is Jabatan Kimia Department of Chemistry. Yeah.
Sorry, Joseph from Reuters. Just to check, is there any timeline you're expecting the report to come out?
It depends on the lab analysis, so we are waiting for that as well.
Did they give an indication?
So far, we have not. So we are still pending for the results and reports.
So do you mean the specimen sending to the lab is including the one the poison type?
Yeah, the lab will look into both in terms of the analysis of the specimen, and also we will try to look into if there's any poison and etc. So that also will be part of the analysis.
So what is the preliminary reports point towards?
So we, until today, I think that's we are waiting for the lab results.
No preliminary.
No, not yet.
The main question is, what is the cause of the death?
I beg your pardon?
One of the main questions, what is the cause of death? Is it poison or something else?
So we are waiting for the lab for us to confirm based on the specimen taken during the post-mortem.
What is the
How long will it
general
take?
is he healthy man? Is he healthy man? What is general physical condition of the deceased before he arrived? I mean, telling from his body.
We need to look into the medical records, but we do not have access to the medical records at the moment.
How long did it
North
take
Korea
to
is
take
saying it's a heart attack. They say they would hold it.
No evidence of heart attack.
How long is the examination will take?
We have to wait for the Department of Chemistry to come up with the reports. Then only we can make a conclusive conclusion to this.
Sir, can you confirm that there are no puncture wounds or any needle marks found on his body?
At the moment, not obvious.
Nothing obvious for us to suggest any puncture marks or wounds.
So can you confirm the rumor about the cancer arrived at this hospital present station?
Kim Han-sol, his son.
Cancer care arrived there here.
Well, so far we are still waiting for the next of kin to report to us.
Sir, what's the point of identifying the diseased body by his using fingerprint or his body part?
Yeah, it's part of the identification in any homicide case, homicide victim identification. So fingerprint is important for us to identify the person.
So if he is identified, then what? So what's the next step?
The recognition of the person is right.
Do you have a plan to get Kim Jong-nam's family's DNA?
We hope that the next of kin comes, and perhaps we can get the DNA from the next of kin. That also.
How is this external condition? Was his face red or was his pale? Any external condition of his body after he's been transferred?
I don't get the question.
Are any signs suggesting that he died because of poisonous substance?
We have to confirm with the laboratory investigation and confirmation from the lab before we can make any conclusive remarks.
Since you're an experienced doctor, this is a rare case as your career?
This is part of the post-mortem that we do.
I mean, this case it seems like a quite bizarre and rare. You're an experienced doctor. This is the first time that you see the
No,
body.
this is not the first time.
Sir, how long will you keep the body here if the extra Kim doesn't come forward?
This is also a police case, but at least we wait for the lab reports before we can take the next course of action.
What kind of toxic substance? What kind of toxic substance was found in his body?
I couldn't understand it.
What kind of toxic substance found? We have no.
We have to wait for the lab report before we can confirm what kind of compound.
So how long is this lab report going to take? How long do you estimate it's going to take?
It's not for me
Another
to.
ministry.
It's not for me to answer this question because it's not done in Hospital Kuala Lumpur. We have to send this to another departments of chemistry.
One last question, please.
It depends on the Department of Chemistry.
One last question.
Okay, last question.
So you can confirm that you're saying that the pathology autopsy was done as a treatment for homicide victim, you said?
It comes for post-mortem. It's a police case, so we have to. We've been instructed by police to carry out the post-mortem. So we have done that.
So treating it as a murder victim?
No, I didn't say that. Yeah, because it was brought in, so we did our post-mortem and the specimen taken and we sent to the lab for analysis. So we have to wait for the lab for confirmation. The lab is not in this hospital. It is the Department of Chemistry in the different agency.
Session is adjourned. Thank you very much for everyone present.
All right.
The session is adjourned.
And Department of Chemistry is in Petaling Jaya, right? All right, thank you very much. Thank you.
Just to verify, so there was no restriction in
Thank you.